Hi again, Meady. Thanks for inviting me to share with you my surprising cancer journey. Why surprising? Because the diagnosis was unexpected, as my lump was initially assessed on ultrasound examination just to be fatty glandular tissue. How was this possible? Let's find out together, shall we? I'm sure you're aware, Mehdi, that what I share here is about my own experience as B in my journey to my breast cancer diagnosis, and it may not be representative of what happens to others or in the majority of cases. It is also not a recommendation for any particular form of medical treatment. I only plan to help you, my friend, and other fellow women to be aware of the possible scenarios they may encounter as they care for their own breast health. Please see your doctor about your own unique situation. With that understanding, allow me to begin where my cancer journey started. Several years ago, I felt lumps in both my breasts. Having seen a family doctor about it, an ultrasound examination of the breasts was organized for me. A mammogram was not performed as part of the initial evaluation because I was younger than 40 years old. As you can see, the findings identified on ultrasound was reported as fatty glandular tissue within both breasts. However, the surgeon whom I was referred to regarding these findings disagreed with the radiologist's assessment that these were merely fatty glandular tissue. This was because the edges of the right breast findings were scalloped rather than being smooth, as would be expected in a low-risk lesion. So the surgeon explained to me that there would be a 10% chance of the finding in the right breast being cancer, and recommended a biopsy, as a definitive diagnosis can only be made on pathologic examination of tissue removed from the breast. She also suggested a biopsy of the larger left breast lesion based on its size and the fact that it could be felt. Alternatively, I had the option of monitoring the findings for any change. I decided to undergo a vacuum-assisted breast biopsy. The pathology of the tissue removed from the right breast was reported as ductal carcinoma in situ. This is early breast cancer. The tissue removed from the left breast was reported as fibrocystic change, which was not cancer but rather the result of hormonal influence on the breast. I learned that the ultrasound images may not provide a true reflection of what kind of pathologic changes are occurring within the breasts, and it is only a biopsy that can tell its actual nature. I was really glad that I made a decision to do a biopsy because I managed to have the cancer treated at a very early stage, and I am happy to report that all went well with treatment. I know that there will be women who would choose not to have a biopsy, as the majority of women who had findings like mine actually have benign pathology. Having a definitive benign diagnosis, however, is not known for certain until tissue is removed for examination. I am aware that there is controversy about whether women like me with low-grade ductal carcinoma in situ, or DCIS for short, should undergo surgery or active surveillance. I also understand from my doctor that we are awaiting the results of studies to guide us with respect to the best treatment approach for DCIS. Until the data provides robust evidence, breast conservation treatment is an option to consider. My doctor is happy to discuss the current evidence about the surgical treatment in the next video section. If you have found the information useful, please like, subscribe, comment, and stay tuned for more. I wish you all the very best for your health. Cheers!